with this coronavirus. So it's time to take care of yourself. Now, I also want to let you know, so you don't let your guard down, that according to Medscape, there's a variant out there called Delta variant, and it's driving the COVID spike back up again. So we have to be careful. So this started in the UK. It started with India and then moved to the UK. So in June 18, 2021, the number of people infected with the coronavirus in England has increased rapidly, with most infections happening in children and young adults. Now remember, there's no vaccines yet approved for children 12 and under. So adults, you have to protect yourself so you can protect your children. Now, also young adults are getting it. And mostly with people who have not received any vaccinations yet, according to the new research. But we also see that there's people who've been fully vaccinated that are also having breakthrough coronaviruses. The Delta variant, which is the first identified in India, it doubled every 11 days in England. These data coincide with the Delta variant becoming dominant and shows important continued monitoring of infections and the variants in our communities. The Delta variant is more transmissible, meaning you can get it easier. It's also is causing increased hospitalization and serious illness, especially with the unvaccinated. Now, vaccinated people can still, like I say, you can still have the breakthrough and get the coronavirus. So you have to stay vigilant out there. Now, if you're vaccinated, you tend to not have serious illness and possible death. But, there's variant viruses, and there's not enough of us vaccinated to keep it from continuing to be a variant. Now, symptoms may appear 2 to 14 days after exposure of the virus. Median incubation period of COVID is like 4 to 5 days. You can experience symptoms within 2 to 7 days after exposure. People are considered fully vaccinated if they are 2 weeks after their second dose of the Pfizer or the Moderna, and the Johnson & Johnson is a one shot. So the pandemic is not over yet. Keep wearing your mask. Don't throw them away. Keep them with you, because some indoors will require you to wear your mask and continue to social distance. When you go to these businesses, they are employees. So Cal OSHA is driving that standard. So be prepared and don't be angry or don't go to the businesses. So have your mask ready. Be ready to social distance. Have your patience. Try not to group up outside of your household indoors. That increases your risk for the coronavirus. Now, taking care of yourself means taking care of you and your children. Now, the American Academy of Pediatrics, they update recommendations on how often you should have a physical, especially recommended for children. Children, the physicians to ensure newborn screening, panelists that perform review results and follow up as needed. So if you don't go to the doctor, you can't get the proper follow-ups for your child to prevent medical complications. Now, there's also children receiving ongoing well-child exams. Now, with babies, it starts early because, they're newborn. So they get their first well-child exam when they're 3 to 5 days old after birth, right? And then they get it for several months after that. They get it at the 1, the 2, the 4, the 6, the 9, the 12 month, the 15, the 18, the 24, and the 30 month. And then after that, it's from 3 to 21 years old. So you have to make sure your child is keeping up with those well-child exams, which includes the required immunizations that they need as well. They'll take their measurements of their head, which is head circumference. They measure the head. They also measure your height, your weight. The BMI will determine your child and see if your child is overweight or obese. And it's very important to catch this early to prevent childhood obesity, which is a growing epidemic even in babies. So you have to really monitor your children. Being overweight starts at BMIs that are 25, and then it can go up to severe obesity at 40 percentile BMI. So remember, that's the combination of your weight and your height based on national averages. They also will be monitoring blood pressure. They also monitor vision and hearing for your children, which is important because if your child is having vision problems, they can get corrective lenses. If they're having hearing problems, They can also get hearing aids and get whatever special treatments that they need to make sure that they're successful. Now, the immunizations are given from the start, even at birth. At the hospital, they'll get hepatitis B. That's their first vaccine that they will get. And the vaccines continue up until a booster at 16 years of age. So vaccines are very important. They help prevent diseases. That's why you get the diphtheria. That's why you get the Hib, which is the hemophiliac emphysema stereotype B disease, hepatitis A and B. They get those vaccines as well. These are all to help prevent diseases. We know about the flu vaccine, the measles, the pneumonia, the mumps. We know about the percussion, the whooping cough. We know about all of those different things, even polio, rubella, measles, tetanus, typhoid fever, chicken pox, and yellow fever. And now, of course, we have the COVID. We don't know what's going to be the recommendation, but that's pending, and that is to be coming in the future. Please ensure that your child receives the HPV vaccine, which is the human papillomavirus, which it should start at age 11. This helps to prevent cervical cancer. Now, and also different types of breast cancer. So boys as well as females should get the HPV vaccine. So when your doctor recommends it, they usually, some start at 11, some start at 12. But it's a series of 3 doses that your child should have to prevent them from getting cervical dysplasia, which is a precancerous condition with abnormal cell growth that occurs in the surface lining of the surface and the epithelial canal opening between the uterus and the vagina. Now, also, the more sexual partners that your children have, it increases their chances for getting HPV virus. So you want to teach them about, waiting, for that special someone. If not, protect them. Have them use condoms for safe sex. If you got to teach your kids this. Talking to them doesn't mean they're going to start having sex, but you need to prepare them because it's going to happen sometime. So you want to make sure you protect them getting the vaccine with the HPV vaccine. Now, continuing requirements are required for, children, like they test for lead to make sure, older homes and some products have lead in it, even children toys with the paints that come from China. A lot of the products that come from China, makeup, different things. So read your labels. If it says it comes from China, then you don't want your child to have that because it could be potential exposure to the lead. They also test for anemia, also tuberculosis. That's a critical lung disease that can happen. Also, it can cause, they also check for congenital heart defects. Some children are born with heart defects. That's what congenital means. You're born with some type of abnormality. It's usually hereditary, so the child can have that. So the doctors will examine your child to make sure that that's not happening. Also, dental exam. Now, this is another thing that parents tend to slack off on, is their current dental exam. Children, they have changed the dental exam. It used to be they didn't have to be seen by a dentist until they were 2. Well, they found that is too late. Too many kids are losing teeth and having too many cavities early. So they want to get them when the teeth start popping up. So they recommend now that you take your child to the dentist at 6 months. And then your child should have a dental follow-up every 6 months to make sure that they're not having any decays. Because what can happen, you can also get serious illness from severe decays in your teeth. It can cause severe dental pain, abscesses, which causes swelling and pus inside your gums. Also gum infection problems, chewing, then your teeth start breaking. Your teeth are shifting because of the decay and the severe teeth that needs to be extracted, meaning pulled out. This applies to both the baby and the secondary for the adult. So some kids, you can pull out those baby teeth, but you don't want to start pulling out the permanent teeth. So you have to start taking care of the teeth now. And this is also good for adults as well, because you can get the same type of infections or worse. Also, changes in one appearance. You start losing teeth, it starts messing with your appearance because you're reluctant to smile. You don't have that great white full teeth smile look, so that can impact your children's self-esteem as well while they're growing up, and you get terrible bad breath. So if your child has bad breath, hey, you need to get them to the dentist, but take them, be preventative. Make sure that they don't develop complications. Dental pain can cause, it can be quite debilitating if this occurs. The actual pain occurs when the decay is close in proximity to or entered by the nerve, so it can cause damage. The pain may interfere with your normal routines. You know, if you have a lot of pain, it's hard for you to focus and to do anything because of the severe pain. You know, whether you're going to work or school, and then you wonder why your kids are not performing well. So this is why they can't eat properly or eat healthy. Uh, so they're not getting enough nutrition, abscess in teeth and gums infections. Again, that causes a lot of pain because of the decay in the bacteria. Quite possible they can develop both abscess, tooth, and gum infections. Again, may infect day-to-day lives, leading to possible health issues such as poor nutrition, low immunity, and etc. So right now, we don't want your immunity to be impacted. You want to have the strongest the strongest immunity that you can have right now. So you don't want nothing impacting you. Sorry about that. It could be severe enough to spread and resulting in cellulitis. That's a bad infection. And then this will cause redness and swelling. It could be very pronounced. You can, I mean, really huge. The infection may even enter into the bloodstream, resulting in septicemia, which can be life-threatening. So this is why your teeth are very important to take care of. So don't let your child be neglected, or yourself. Take yourself and get your dental exams. Also, make sure you teach your kids how to use dental floss, because you want to make sure they get the decay often in between the teeth. We don't want it to stay there, because then that causes decay, and it can cause the cavities and the problems. So got to stick to taking care of that dental. Also, you know what? It can cause the teeth to shift around in the mouth. Um, this is what can happen. And, you know, the tooth has to be removed, so then the teeth will automatically shift. I don't know why it does that, but that's just the body's way of compensating. But you don't want that shift to occur. So a lot of times, if you do get a tooth pulled, especially the adults, then you want to follow up with your dentist to make sure you have the implants, so that your teeth doesn't do that shift, and you have the appropriate teeth to do the appropriate biting when you need to chew and bite your food, so it has proper digestion. If you don't chew it well, you can't absorb it well, so that you want to make sure you're able to chew well. Changes in appearance, I told you about that. Also, the bad breath. It can cause very bad breath. I mean, people, you can smell them, and you're only like less than an arm's length from them, then you know that's pretty bad. And if they have bad breath all the time, all day and night, then that's an ongoing problem. It's not like they just didn't brush their teeth or anything like this. This is a serious problem when you have bad breath. What are your options? So what you can do is to make sure that if there is problems, a lot of times if you have abscess, they can't remove that tooth until the infection is gone. So they'll give you antibiotics and treat that. The three main options of removal: dentures, fixed bridges, dental implants. The best choices is dental implants. Tend to work a little bit better than dentures because, like I said, your teeth tend to shift. So you want to make sure that if you do have to pull one, then you want to get an implant. I waited a couple of years and my teeth shift, so I had to get a much smaller one. So it's important to follow up on your dental care. Dental implants are a great solution. Suggestions for your dental plan as well. You want to make sure that you speak to your dentist. Make sure you have dental care. There are options out there that have free dental care. So please check your area and search for those particular dental offices. Do not delay dental care because you don't have insurance. There are free options out there available. You just have to search for them. You can also ask your primary provider for a reference or a referral to select offices that either are going to offer you the free dental care, or if you need specialty dental, like for children that are autistic that may require sedation while they get their dental care. but do not make that a delay as well, because they need their teeth together, taken care of as well. So there also, with this well child exam, includes the developmental surveillance, like like I mentioned, to assess if your child has some autism, if your child has difficulty looking and focusing into the eyes, if they're unable to follow instruction, if they can't sit down, then you need to have them assess and have your provider assess them for developmental screening to make sure they don't have autism or other psychological disorders, some schizophrenia or obsessive compulsive disorders, affiant behavior when they're just acting out. So getting those well child exam covers everything from head to toe. So you need to make sure you get these exams. Also, it assesses for depression. Children can get depressed too. So you want to make sure that if your kids are getting depressed, sometimes it's chemical. They're lacking a serotonin in the brain. So you have to make sure that the kids are assessed, and kids are suicidal as well. So if they start withdrawing and not wanting to do things, then start talking to them, ask them questions, and get them screened. Then they start recommending this at the age of 12. But if you know your child doing it sooner, then start asking your doctor, notifying your provider about the situations that's going on. Also, they screen for tobacco, alcohol, and drug use. It's not just for the children, but also if adults are using it. If adults are smoking cigarettes around their children, you can cause them to become, their lungs will be reactive to smoke, and then maybe eventually even become an asthmatic that they never were before. So if you're a smoker, you want to make sure you stay away from your children and your babies when you're smoking, and make sure you're not, if you're outside, you're not by the window, because it's just, the smoke is just going to come right into the window. So parents, this part is on you, but you want to also make sure you're talking to your teens to see if they are using drugs or taking alcohol. Also, sexual transmitted disease, they start assessing that for teens. Now, there is a law that kids they can go and seek care for birth control, for STD testing, pregnancy testing, getting birth control. They can get all that free through parenthood. They can also get it through their provider, and they can ask to talk to their providers alone. This is a Child Care Act that allows them to be more open with their providers, so they're more protected. Some kids are not comfortable talking to their parents yet. So if you haven't had those sexual intercourse questions or type of behaviors, you need to start talking to your child. Just because you talk to your child doesn't mean they're going to be sexually active, but you're educating your child on how to protect your child and what to do. Also, there's a serious epidemic on sex trafficking. So you want to start talking to your kids about when they're outside, make sure they don't have those double earbuds in their ears, in their cell phone, because they can't hear. They're not watching their surroundings, because what happens is there's men out there that have 2 or more teams, and they wait for kids like that, and they grab them right off the street. They snatch them. So you want to make sure you talk to your children about street safety and staying safe and not being on those cell phones when they're out walking around. Also, you want to talk to your kids about, if you see tattoos that they didn't have before, if you see that the girls are getting their hair and nails done, or if they're having cell phones, and you didn't do that for them, then you need to be having conversations. If they start using drugs more, if you see cell phones, because they use the cell phones, the drug traffickers, to contact them to go up and have a client, sexual client. So if you know that you haven't did this for your child, you need to have these questions and talk to your children. And then also if they're missing days at school, so keep track of if your kid is missing days at school. So you need to have these conversations with your children. Please encourage them to please start talking to your children. That's the most important thing. So when you're having your meals, that's a great time to start sitting down and interacting with each other. How was your day? Talk to your children. Get that conversation. Make sure your children are not too young walking home from school. I mean, they have to be mature enough. They have to be old enough. Some states say you have to be at least 14 older, especially to stay home alone. So check with your state to see what the age is for that state, because if your child is found home alone, the parents can get in trouble, and that's considered breaking a law. So you want to make sure, even if your child, determine, if your child is small, they may be 14, but they may look like they're 7 or 8 or 9. So you have to make sure you look at everything when you're allowing your child to walk home alone, because there's a lot of predators out there, and you have to talk to them and keep them safe. You want to get them a whistle, because even if they're scared to scream, they tend to can grab hold of that whistle and blow that whistle. And you want to teach them to scream and blow the whistle and keep fighting, because you don't want them to get into that car. To just keep fighting and keep fighting, because once they enter that car or van, then they may not come back to you. So start teaching your child about street safety, and get them a whistle that they can wear around their neck, or at least attached to their book, their bookcase, their book bag. Okay, so that they can have it at all times. This is very important. This is an epidemic, so you need to have these conversations with your children. It's a safety issue for children, so please talk to them. Now, if they also do, this is for the parents that are, postpartum after you have babies. They do depression screening for you, postpartum depression, because some mothers do get depressed after they deliver the baby. They'll do it at your screening after the first visit, the 2, the 4, and the 6 months after postpartum. Those are like the peak times when the mothers are having problems with postpartum depression. You've seen that on the news where moms have babies and they kill their children. So you have to, dads, really watch the mom. Sometime with these hormones and things that are going on, they listen to them. If they say they need help, help them. If family members, if you hear that, help them. They're crying out, so please assist them after they having these babies. Adults need to get physicals every year, because there's things that you can avoid getting serious illness with just by going to the doctor every year, to make sure that you're checked up on your blood pressure and all your labs that the doctor does. According to the Medicine Net webpage, diabetes type 1 can be prevented in most people. A lot of times diabetes type 2 is caused because of overutilization and of beating up your beta cells in your pancreas, because that's what produces normal insulin in your body. So that can be reduced or removed if you take care of yourself. Now, there is inherent diabetes, which is type 1 diabetes. And then also there's juvenile diabetes, meaning a young kid. I've had a kid as young as 2 that's a juvenile diabetic, meaning their body just will not produce any insulin, so they become insulin dependent, meaning you got to give them injections. Type 2 can be a chronic condition associated with abnormal sugar or glucose in the blood, insulin produced by the pancreas, lower blood glucose levels. So we normally produce our own insulin to remove excess blood sugar, and that comes from our pancreas. Now, the absence or insufficient production of the insulin, or an inability of the body to properly use the insulin, is what causes type 2 diabetes. Now, the 2 types of diabetes I referred to before is type 1 and type 2. Former names of these conditions are insulin dependent, which is type 1 diabetes, and non-insulin dependent, which is type 2 diabetes. So those are some other terms that you may hear about. Also, juvenile onset, meaning the young kids, like I stated, and also adult onset diabetes. And a lot of times adult onset diabetes is type 2 because of overeating and overutilization of your beta cells. And eventually, if you keep beating stuff up, eventually it's going to wear out. And that's what kind of happens with your beta cells. Symptoms of type 1 and type 2 diabetes include, you can start getting dehydrated, and you really got to watch it now with these hot months. You're going to get dehydrated a lot faster because it's hot. So you start sweating, you want to make sure you're drinking your water. Get out of that sun for a while. Try to be in shaded areas. Wear hats. Make sure you wear your sunscreen. Also, other symptoms include hunger. You get this hunger, this increased appetite. You also do increase, we call these the three polys. So increased hunger, you have increased urination, and you have increased thirst. So you could have increased thirst because your blood sugar is too high, and you can have increased thirst because you're getting dehydrated. But either way, if you're having all of these, then that could be a clue that your blood sugar is too high and your body cannot eliminate the blood sugar properly, and you need to talk to your doctor. Now, other symptoms can include weight loss, and then some people have weight gain. So everybody's a little bit different. It can also, you can feel nausea and vomiting. This is when your blood sugar is high. These are some of the symptoms. Also, blurred vision, increased susceptibility to infection. When you have increased sugar in your body, it increases your chances of infection and your infections to be worse. Because why? Bad bugs love sugar. So that's why the infections increase. Also, vaginal infection in women, yeast infection in both men and women. Other symptoms can include dry mouth, itchy skin, slow healing wounds or cuts or sores, yeast infection, tingling and numbness in your feet and your hands, also your toes. You can have like a fruity type smell to your breath, reduce feelings and tingling in your hand. You know, it's called neuropathy. That's why most diabetics have to get a mirror, check their feet every day, make sure they keep them clean, lubricated, and dry. After you dry really well, keep it lubricated, because dry, cracked skin will break a lot faster than lubricated skin. So it's very important. So living a healthy lifestyle, you need to exercise 60 minutes a day. Yes, a day. You need to commit to that, whether it's 30 minutes in the morning and 30 minutes at night, or 60 minutes all at once. As long as you're getting that 60 minutes in, you can get it in. Stay with me to the end of the show, because I'm going to show you how to do some easy motion exercises, right? You want to also make sure that you're eating healthy. Keeping what we call the hemoglobin A1C. That's the percentage that the doctors will check to see if you're diabetic or not. And if you're diabetic, it's from 6.5 or higher. So you want to be under the 6.5, because then there's pre-diabetic. But if you start taking care of yourself, you start exercising every day, you cannot become a type 2 diabetic. But you gotta be healthy. You gotta exercise. You gotta go to the doctor. So if you're overweight, you definitely need to go see your doctor, because you need to know if you're a type 2 diabetic or not, so you can start getting on top of things, so you can try to reverse it. You can reverse it, but if you just wait and wait and wait, it becomes permanent. And then after you're type 2 diabetic and you're still abusing that, you can start becoming insulin dependent, because you have burned out your beta cells from your pancreas that won't produce any more insulin for you. So you really have to watch yourself, especially if you're overweight. And the weight around our abdomen is the most unhealthy weight. So we want to make sure, and you know if you're overweight or not. If you have excess weight around your stomach or on your thighs, if your legs are rubbing together, if you have arms that are wobbly, you know when you're overweight. Your clothes are too tight. You have to get larger clothes. You know you're getting overweight, so you know you need to go to the doctor. Some people say, oh, I don't want to know. But you do need to know, because the sooner you find out, the more you can protect yourself and prevent yourself from going into being a diabetic. You don't want to become a diabetic. It causes a whole lot of other problems. So the BMI, that's your body measurement index, which includes your height and your weight, it needs to be below 25. 25 or higher gets you to mild, moderate, and severe obesity. So you don't want that. This is also happening in children as well. Now, the increased risk factors, what happens is it increases, like I say, overweight and obesity increases your chance for diabetes, which we don't want. If you can prevent it, then we should prevent it, right? It also causes a whole slew of other complications. It can increase blood pressure or hypertension. Also, low levels of the good cholesterol, your HDL, that's the good cholesterol, and elevated levels of the triglycerides, which is the bad cholesterol that's in your blood. So you don't want that, because then you start getting into hardening of your arteries and plaque, and that starts a whole nother cardiac problem, a heart disease. So you don't want that. When you have type 2 diabetes, you need to eat a good mix of proteins, carbohydrates, and healthy fats. So what is a well-balanced dinner, a power breakfast? The New American breakfast, it accounts for 294 calories, which is and 40 carbohydrates. This quick meal delivers protein, like in a scrambled egg, and they also have some lettuce, some spinach mixed in it, and just 40 carbs, mostly from fiber-rich oatmeal and blueberries. So you can put blueberries in your oatmeal. You can put strawberries in your oatmeal, raisins in your oatmeal. These are some things that provide you with great fiber, and it helps your digestion. It also prevents sugar spikes because it takes a while for the body to digest it. So it'll just slowly have that digestion so it doesn't spike way up. Like if you was to drink a can of soda. Soda is too much. You should stay away from sodas. Okay? No sodas. Now, other things that may spike your blood sugar, you need to watch all types of carbohydrates, cereals, bread. Bread has anywhere from 6 to 8 teaspoons of sugar. By the time you digest it, that's what happens. So if you're eating bread, you might as well just eat a bunch of candy because you got a lot of sugar in there. Also, you want to decrease your rice and your pasta, all your starchy things, starchy vegetables. And you know, when you have on your plate, it should only be a quarter amount of the rice or the starches, your potatoes, not half your plate or 3/4 of your plate. That's way too much carbohydrates. So you want to cut it down. Half of your plate should be more fruits and vegetables. Half, yes, half. So switch that around. Instead of having half your plate is rice and potatoes, switch it around to vegetables and fruit, because that's what you should be having. And then healthy proteins, ham, chicken, turkey, okay? Also, you should be avoiding sweets, 100% milk. Oh, no, no, no. It's too many calories. You have to try to decrease yourself to 2%, then 1%, and then non-fat. Drink almond milk, rice milk, goat milk, those cashew milk, rice milk. Those are more healthy milks for you. And you have to watch some yogurts as well. You have to get the ones with the least calories in there. And some yogurts put a lot of sugar in it. So you have to really start reading the label so you know what you're getting. So you want to spread your total carbohydrates across the whole day. You don't want to eat like, and I did this too once. I'm bad at this too sometimes. You get a plate of pancakes with your syrup, you have your eggs and several pieces of bacon. You know, you talking about 1,000 calories or more, depending on how much syrup you put on it. Then if you throw in some juice and some 100% milk, then you're going to even more calories, which you have almost extended your total calories for the whole day in one meal. So you have to watch all of that. Now for lunch, a good sample of a good lunch is beef and bean enchilada, counts of 443 calories and 48 grams of carbohydrates. Lean beef and black beans make Mexican dish a good option for a diabetic diet. The fiber in the beans can help lower blood cholesterol and control blood sugars. Go heavy in veggies and light on cheese. Not so much cheese. I have to pull back on my cheese too. So light on cheese, heavy on the vegetables. Enjoy 10 small corn chips if you want to. Granola snack, guacamole for your chips. You can enjoy that too as well. For dinner, you can have pork tenderloin meals that count like 360 calories, 42 grams of carbohydrate. Pork tenderloin is one of the least and most versatile cuts of meat. It's prepared with Dijon mustard glaze, served with steamed broccoli and mock smashed potatoes. Puree cauliflower bran, beautiful carbohydrates, healthy white potatoes. Round out the meal with a whole wheat dinner roll. One dinner roll. Okay, so we're going to take a break, and I'll be back, and we'll do some of the easy motion exercises that I had mentioned. start off with 3 sets of 10, and then when you get further advanced, you can go all the way. Hold your abs down, and come up, you do this, sit up, right? And make sure you're working your arms as well. Now, go to the floor, do some more exercises. Okay, so we're on the floor or your bed, wherever's easiest or most comfortable. And since we're here, we can keep our legs apart and work this inner piece of the thigh right here. So you just open your legs apart and you just open and close. That's for this part, right? Then the next thing you can do when you're here, since we're here already, take the palm of your hands, put them down on the floor, and you can hold your abs in and you can lift. These are pelvic lifts. So you can either hold it for a count of 30 or you can go up and down for 3 sets of 10, right? So whichever one you're comfortable with. And then even while you're sitting or even driving your car at work, you can hold your ab in. Those are isometrics. And you can hold it in for a count of 30 or do 3 sets of 10s. You can do that too. So that's isometrics when you hold your ab in, okay? Those are isometric exercises. Now, if you want to, once you get more advanced with your exercises, you can do the lifts. And then what you can do is, when you're holding yourself up, you want to continue to hold yourself up, right? And slowly lower your feet while you're holding yourself up, right? That's when you get stronger. So you can try that when you get a little bit stronger, okay? Now, another thing you can do since we're here, another exercise, you can let one leg go to the side. So you're here, and you're going to lower it. Now, if you can't go all the way, then you go where you can go, so you can go all the way, right? You don't want to turn. You want to lower, keep your body straight and lower the leg. And this is going to be good for those love handles, right? And remember, always do both sides. I'm going to show you it, but I want you to do both sides. So you start where you can start until you can go lower, okay? Now, another thing you can do is 2 legs together. So go to the side, you start where you can go, then you can go more, and then you go even more, right? And you see how this stretches this side right here? That's for those love handles right here. This is the mic box, so just ignore that. But anyway, it's good for that, right here. See this? So that helps those love handles right here. So this is really good for that. And remember, you gotta do both sides. And like I said, you can't go all the way. Go where you can go until you can go all the way. Okay? And this is also a good stretch after you're through exercising. If your back is hurting you, you can stretch like this, and it'll help stretch out that back. Okay? Now, since we're here, you can get a resistance band, and you can put it over your knees, or not if you haven't used it yet. But the resistance band gives you greater resistance. So the tighter and shorter it is, the more resistance you can have. So when you get more advanced, you can do that. Now, if you're not used to exercising, then don't use a band, but you can just lift, hold it, or you can do 3 sets of 10, right? It's 3 sets of 10. Now the most important thing is make sure your hip is over. So a lot of times I like to put my hand here, that way I know I'll hold my hip over, and then you can open the legs, right? Then you can also stretch it out, and you can go up and down, or you can do the isometrics part. Like I said, you can hold it for a count of 10 or 30, and then you want to make sure you do it on both sides. Now, another thing you can do is make sure that hip is over and move it to the back, and you can do this way as well. Okay? So that, remember, is both sides, not just one side. So, I'm giving you several exercises you can do, and you should rotate them up because your body gets used to them. Now, you can also do, we can do lifts. You can lift your feet together, right? Or you can lift them one by one, wherever you can lift, here, 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 until you can go higher individually, and then you can do them together, low, here, here, here. Okay, so there's different starting points you can go to, and then also it gives you more resistance if you're here and you go down slowly, holding in your abs, right? That's another thing you can do. Slowly, right? Control, right? Okay, so that's another thing you do. You can do this, right? Scissors, okay? Like I say, you can do the lift, right? You can also do another pelvic lift by lifting your legs, right? You can try the one, right? And then you can do two, right? And then you can do slowly lower down when you get more advanced. And then you can come up and you can do both, right? Okay, now another one, you turn over. This is for the back and the back of the thigh and the buttocks, all those cottage cheese or moon craters. So what you want to do is lift both feet. You can do one, right? And you can do both wherever you can lift. If you have knee problems, then you might not be able to go all the way. But if you can, great. So single, wherever you can go, right? Both, wherever you can go. Okay. So now we're gonna do some standing. Whew. Make sure you stay hydrated. It does work. Okay. So while you're standing, it's warm today. Okay, so you can start making your core stronger by, when you first start, you need to hold onto a dresser, a chair that's not moving. You want to be able to stand without holding on and maintaining your balance for at least 30 seconds, right? And then you want to make sure you do it on both sides, the same thing. But until you get used to it, you're going to have to hold on. It took me a minute too. Took me several months, but I finally got there. So don't be discouraged. Just keep going. Hold in your abs, tighten those buttocks cheeks, and whatever thigh muscle you're on, tighten it. Okay, it doesn't count if you're doing all this. You have to make sure that you're actually holding your balance up in a straight, not crooked, all that. If you're doing all that, start over because you're not developing your core. Now, also, you can do side leg lifts, right? Either hold onto a sturdy dresser or your bed or a chair, and you can do side lifts. If you're can't do our way, go where you can go so you can go higher, right? Always holding your ab. And then remember, you got to do both sides. Both sides. Okay, now, another thing you can do is what I call standing sit-ups, right? So you have your feet apart, right? Now, if you have back issues, then you want to go slow because then you get back spasms. So you go where you can go, whether it's your knee, your calves, back of your calves, ankle, top of your foot, or the floor. So make sure, like I said, if you have back problems, go slowly wherever you can go, right? And then this is also a very good warm down exercise to just stay down and hold it here. This is a good way to stretch your back, right? Now, we also want to mix it up a little bit. So bring your feet in a little bit, and then you want to go to each side without twisting, right? So go to the side, right? Go to the middle, and then you go to the side, right? Now, another thing you can do is you can actually do the twist. You can twist, but you want to make sure you're not twisting your hips or your legs, right? You want to make sure you're staying firm, and it's only your side that's twisting, not your hips and your leg. That's the wrong way. You want to make sure you stay firm and you're twisting here, right? So it's only at the waist you're twisting, okay? And then you can get some weights, and you can do some leg lifts and some arm marches, right? Depending on where you are, you can do low leg lifts, and then you get to where you can get big ones. And if you're moving the arms, it'll help you because you're doing more than one thing at a time. The weights is just added. This is about 2 pounds. Now, if you don't have weights, I usually have a water bottle. Since I don't have them, I use my vitamins for now. But you can use containers, you can use vegetables, just pretend these are vegetables, and you can use those if you don't have the weights. So, okay, so now what we're gonna do, there's one more thing I want to show you. You're gonna make sure that you have a sturdy chair or couch, because we're gonna do what I call chair squats. It makes it easier for you to squat, because if you're not used to it, you can raise your chair and you don't have to go as low, right? So you can do that, and these are still considered squats. Because why? Because you're standing, you're bending at the knee. When you get better, you lower your chair, right, to whatever level, but then that makes it a little harder, right? So these are still considered squats. So when you're at work, taking a break, get up and sit down a few times. Just make sure your chair is secure. Now, when you're standing, if you have knee problems, you want to make sure that you are sticking your butt out to take the pressure off your knee. So you want to sit down squat. So what you want to do is act like you're sitting, right? So stick your butt out and squat. That's if you have knee problems. Okay, so why the producer gets the mic together, we'll use the hand mic. So, anyway, like I was saying, for the squat, you want to stick your butt out to take the pressure off your knees, right? So you want to do like a sit down. See how your butt goes back? It takes the pressure off your knees. So you want to do a sit down squat. That's if you have knee problems. If you have knee problems. Now, if you don't have any knee problems, then you can just do a regular squat. Like so. So you got 3 versions of doing the squat. You can do it with your, if you have knee problems, sit down. Or you can do a regular squat. Okay, hold on a second. I'm going to change mine.
One, two.
exercises that we can do while we're sitting. So, okay, so what we're going to do is the same thing we can do lying, and we're going to do sitting, where you open your legs for this inner thigh. You just open and you close, right? That's for that exercise. Now, another thing you can do, we're going to do the 4-point lift, where you can lift, stretch out, end it up, and put it down. Same thing. Bend it, put it down. Now, when you want to do both, then you can start low with both. Low, medium, high, right? So depending on where you are, depends on how you're going to lift it, right? So that's what you do, right? Another thing you can do the basic scissors. Yeah. Now, another thing what I found really easy to do while I was waiting for an appointment at the doctor's office is you can hold your legs up, hold your abs in, and then what you do while you hold it up, it not only contracts your thighs, but I want you to point your toes and bring them back. So then that works your calf as well. So you're working several muscles at one time. You're contracting the thigh, which is isometric, but you're also moving your toes, pointing them forward to work your calves. So you can do that for 30 counts. You can just hold it for 30 counts. It's up to you. Either way, go. And then when you put your legs down, you be like, oh, yeah, I feel that. But that's a good exercise while you're waiting for an appointment, right? Or if you're at work. And a lot of times, even when you're at work, you can even just hold your legs up like this while you're typing, whatever you're doing at your desk, and then you can add the toes in, right? You can do that. And then you can also do toe lifts while you're sitting. So you're lifting, right? You're lifting up on the bottom of actually it's part of your foot, right? So, but it looks like you're on your toes more, but it's actually supported by this part of your foot. So you can do that. You can also do that while you're standing as well. But make sure you have something to hold on to so you don't lose your balance. So you can do those lifts. You can do them individually. You can do them together where it looks like you're kind of running. And then get your waist back involved, right? While you're doing it, while you're doing your lifts. You can get all this stuff going on while you're sitting, right? Now, let's do the sitting sit-ups. Your legs, right? So, this is not as hard on your back as if you stand. So, you go down, touch the floor, and come back up. Right? So, it's like 3 ways to get in the sit-up motion. Right? Lying, sitting, and standing. Right? Now, you lace a little inward because you want to do the side too. So we want to do the side, right? Middle, side. Remember, no twisting. You see my chair twist, right? You're reaching, right? Reaching. Wherever you can go. If you can't do the floor, then you do the back of your calf. You do your ankles. You do the top of your foot. Until you can get to the floor. It's a good stretch out too for the back as well, right? Okay, so another thing you can do for the arms is you can get a retention band and tie it in the middle, make these loops. So you can put one hand on the knee, one hand on the chair arm, and you can do curls, right? Now, if you want to increase the retention, the resistance, then you just open your legs first. So that increases the tension on your curl, right? And if you're not there yet, then you can bring it in until you get used to it. And then rotate your feet, switch hands off, right? So then you can do your curls, right? And then again, remember, stretch your feet apart because that's going to increase the retention, and you can do your curls again. So if you don't have the weight, you can use the water bottles or canned vegetables or fruit, but retention bands are also great to give you more resistance, make it more difficult for you to complete, right? Okay, so do that. You can also do for arms. If you don't have any shoulder problems, you have shoulder limitations, then you don't want to be bringing your shoulders up above your head. So if you do have shoulder problems, then keep your arms at your shoulder length and go this way, right? If you don't have shoulder problems, or if you do, then put it more back and go back this way. So it just all depends on what type of limitations you may have. Depends on how you do your exercise. But the main thing to do is the exercise. Now, I want to introduce you to my pepper. It's a cutie. And I remember when I first got this, I couldn't even lift it. Now I can lift it with no problem because I keep doing it. The more you do stuff, the stronger you get. Okay? So, anyway, this particular pepper, and all peppers, I had other ones and I used it so much it broke. But the point is you use it. So it has a resistive tension dial here at the bottom, and then it has it calculates how far you pedal at the top. So you can put on your favorite show, and you can pedal and exercise your arms at the same time. I usually I have a 5-pound weight, and I'll do like 75 curls at least 5 times, but that took me a while to get there. I started with 3, like maybe 30. Like I told you, start with 3 sets of 10, because if you're not used to exercising, you're going to feel it. Trust me, you're going to feel it. But that's okay. That means you need to do it. So also with this particular peddler, it can go backwards. Now all peddlers can't, but this one can. So you want to rotate the directions as well as how long you do it. So if you're sitting there watching Queen of the South just went off, man, and you're watching it, that's a whole hour. So by the time you get to a few commercials, you already done 30 minutes, right? So if you do the whole show, that's a whole hour. So just think about that. Now, if you T-bone it and recording it, it's only about 45 minutes. So just know you need to see another show with at least 15 more minutes to hit your 60 mark. Unless, like I say, you can do 30 minutes in the morning, 30 minutes at night. I do both. I do like 30 minutes in the morning, then I do more than an hour at night. So, doing different exercises. Remember, it's very important that you do different types of exercises because your body gets used to certain ones. So you want to change it up. So then it's more effective for you. So rotate your exercises. So I'm showing you several different ones that you can do. And you can do this while you're watching TV. So there's no reason not to exercise while you're lying down on the couch or in the bed, or while you're sitting or standing. So you can exercise and you can deal with getting healthy again. You know, if you have a treadmill, fine, use your treadmill. Turn it on when you're watching your favorite TV program. And I guarantee you, you will see the difference, you will feel the difference. Even if you're tired, do your exercises because you still feel better after you exercise. Now, it's very important that you do these things to stay healthy, exercise. Also make sure that in order to keep your immune strong, make sure you're taking zinc if you don't want to have the food products. The food products is, your broccoli. Also, blackberries are very good. And what you can do is you can freeze them, so rinse them and freeze them, and put them in a freezer bag. And then that way you can pull them out whenever you need them. Because otherwise berries tend to go bad really fast. But if you rinse them and put them in the freezer bag, you can take them out of the freezer. You want to use them, so that's great. Now also for the immune, building the immune is avocado. It's great, right? It's a great fruit and vegetable at the same time. Now also eating almonds and cashews also builds great immunity. You want to also, we already know about vitamin C, right? So you want to take your vitamin C. You want to also take your vitamin D, and my D is calcium, so it's good for your bones as well. So it's been proven research that they've given vitamin D3 to coronavirus patients, and it helps to improve their symptoms dramatically. So why not take it every day? Also, I take B complex, like if you're having problems with anemia, like thalassemia, this is good for you to help keep your blood flowing very well and help you make your red blood cell. It has folic acid in it, diamond, it has all the B vitamins in it, like B complex. And then also, if you're having problems sleeping at night, you can take some melatonin. Melatonin, you take it about an hour before you actually want to sleep, and then you'll be able to sleep better for the night. That sleep is uninterrupted sleep. You need to sleep. That's when your body's immune system reboots. So you need to get enough sleep. Also, coronavirus doesn't like acid products. So guess what? The avocado is good acid content as well. So it's good for the immune, and it's good for the acid content to help fight the coronavirus. So is limes and lemons and oranges and pineapples and grapefruits. All of those stuff have acid in it, with natural acid that the coronavirus doesn't like. So there's no reason not to eat healthy anymore, because they have all these home delivery groceries that you can get and have it delivered. So there's no reason not to eat healthy. You want to make sure you get your kids off 100% milk. Don't be ordering no sodas in the house, and you can't drink sodas either. Make sure that you sit with your kids so they're not eating too fast. And you too, eating too fast, slow down, because it takes time for the brain to tell the stomach that it's full. Proven research. So stop eating so fast, slow down. Drink a whole glass of water before you eat. That helps to fill you up a little bit, but then slow down, because you wind up eating 3 to 4 times the calories in the food that you need. And then that's why you feel sick after you get through eating. Your stomach hurts because you ate too much. And every time you stretch your stomach, you're going to need more and more and more, and that's how you gain weight. So sit down with your children, eat with them, have them drink water. 50% of their plate is fruits and vegetables, and so should yours be 50%. Not 50% pasta, beans, and spaghetti, and rice. No, vegetables, 50%. Okay, you should only have a fourth. Okay, fourth of your plate. And remember, don't pile it on top of each other, several floors. You're defeating the whole purpose if you pile it on several floors. Keep it all on one level. You're just piling it up, you defeated the whole purpose. You're still eating 2, 3, 4 times the amount because you have all these different stories of food. That's not going to work either. Okay, so all your kids should have current well child exams, physicals every year. Like I said, if it's a baby, you got to go more often. Between the first 3 to 5 days of birth is the first exam. Then you have the 1 month, 2 months. You have the 4 months, the 6 months, the 9 months, the 12 months, the 15 months, the 18 months, the 24 months, the 30 months. Then you go from 3 all the way up to 21. So, and including in those well child exams, not only, remember I told you everything they're assessing from head to toe, right? They're also making sure you have the kids have the proper vaccinations, make sure that they prevent them from getting the chicken pox and the whooping cough and the measles and all those other problems, right? So you want to do those things. Lead testing, making sure their blood levels are okay. Everything you want to do developmental as well, making sure they're meeting what we call milestone, meaning whoever's 4 months should be able to track with their eyes. They watch you, they smile, they're responsive to the face, making sure they're meeting all those developmental milestones, meaning they're doing what they're supposed to do at that age. So, and if they're not, then the doctor will do an assessment and then determine if the child needs to be assessed through the regional center or developmental specialist to determine if the child has special needs. Then they will give them those needs and give them the special treatments that they need to bring them up to current. Those supportive services. So you want to take care of yourself, parents. If you can't take care of yourself, you can't take care of your kids. So you got to go take care of yourself. Go get your physical. You know you're overweight, get your physical. Go get checked every single year. Now, you can reach me at healthyliving.company. That's my website. You can send me a message there, or you can also contact me here at the Next Level Studios, 310-549-1113, 310-549-1113. And the producer of the show is TJAM. It's TJAMZ. You can reach him at tjamsmusic.com. And you can send him a message here as well, on his website or here at the Next Level Studio, 310-549-1113, 310-549-1113. Now, coronavirus is not over. I think it's going to be here with us forever. But still, stay safe, wear your mask, get fully vaccinated, protect your children. Okay, I'll see you in a couple of weeks. Happy Father's Day to all the fathers. Okay, stay safe. Bye-bye.